Acupuncture is the placement of needles into points in the body known as acupuncture points, or collective centers of energetic convergence along meridians. It is an invasive procedure and it should be performed with care, appropriate sanitation, and antiseptic measures, as well as biomedical waste and sharps disposal. In a modern medical setting in Taiwan, acupuncture needles are disposable devices that come in different lengths and diameters. Doctors are able to select and order acupuncture needles of their preference and needs. Acupuncture can be performed on any part of the body, including the trunk, the limbs, on the face, scalp, and ears. It is a profound discipline in traditional Chinese medicine. Chinese medical doctors in Taiwan are required to study Chinese medicine at med school, and the study of both medicine and Chinese medicine is considered the preferable combination for Chinese medical doctors, since it would provide sufficient background knowledge and discipline for clinical practice in traditional Chinese medicine. When acupuncture is performed, it is important for the patient to be in a comfortable position, usually laying on the back, laying prone, which is laying face down, or be seated with support on the backside. It is best not to receive acupuncture treatment on an empty stomach, since acupuncture is an invasive procedure and all treatments will require a certain amount of bodily energies to take effect. It is the same when we eat food. We also need our own bodily energies to assist with digestion and absorption of nutrients. When a patient is being treated with acupuncture, there is very fine and complicated energetic redistribution throughout the body. While many come for treatment under a certain degree of duress, such as pain, soreness, fatigue, or injuries, their reserve of body energies may not be enough to aid large energetic changes in their body equilibrium, and while on an empty stomach, certain discomfort may be experienced, which is known as needle faint. The patient may feel sweaty, faint, dizziness, or even nausea, but the typical kind of faint is the actual fainting of the patient, where he or she may suddenly lose consciousness for a few seconds and would wake again, but usually without knowledge or memory of what actually happened. Acupuncture and traditional Chinese medicine is essentially about redistributing the body energies so that it can reach a more stable and more comfortable equilibrium. However, when these energies are adjusting, it is essentially the cellular interactions inside tissues that are doing the work. This involves tissues, blood vessels, and neurons working together to assist the body into a more stabilized, autonomic state. And when needle faint happens, it is actually the body unable to follow up with these changes, so much so that the nervous system becomes overloaded and it goes into shock. And the body would use this brief moment of loss of consciousness to regain some strength into stabilizing itself. There is essentially no real danger in needle faint, but regardless of the patient being conscious or unconscious when it happens, it is important to extract all the needles, have the patient lay down, and if he or she is seated in a chair, it is best to hold them steady, because during this experience, the body is usually unable to control itself in terms of sensory and motor functions, so it is best to hold the patient steady to keep them from falling. For patients who are laying down but feel nauseous, keep their heads turned sideways to avoid choking. Provide something sweet to eat or drink so that the body has some immediate energy to regain strength, and keep the patient warm during the process. Another clinical danger of acupuncture is the pneumothorax, which could happen when the lung is punctured. With myself, I don't usually perform acupuncture over the lung areas which are not protected with burn, such as shoulder blades, the sternum, the spine, and the ribs. When I do perform acupuncture on soft tissue areas over the lung, I would insert the needle very shallow to avoid puncturing the lungs. When acupuncture is performed, we usually avoid major or visible blood vessels, but there is a certain chance of bleeding from local capillaries, or when treating an area where the tissue is lacking its normal flexibility, some blood vessels could be punctured, leading to some bleeding or subsequent bruising. These can be observed when extracting the needles, and the bleeding could usually be stopped with some pressure and medical cotton balls. Since acupuncture is not about puncturing blood vessels on purpose, this bleeding can be considered as bleeding, which is the deliberate puncture and bleeding of blood vessels as a means to release pressure in desired areas. However, with bleeding after the extraction of the acupuncture needles, one does not need to force out any more blood, but simply stop the bleeding by using some pressure and allow any subcutaneous bruising to be absorbed by the body. After the acupuncture needles are extracted, the skin is expected to close the puncture by itself. When a patient is especially fatigued or tired, there can be latent bleeding, where no bleeding is observed upon extracting the needle, but some blood can appear after a few seconds. There are no specific problems with latent bleeding, but it is a way of observing general circulation and condition of the treated area. In Taiwan, acupuncture is used to treat a wide range of discomfort, ranging from muscle pain, soreness, sprained or strained joints, headaches, sleep disorders, post-surgical care, or patients with cerebrovascular accidents. When combined with Chinese medical herbs, acupuncture can further treat ailments relating to our internal organs, such as menstrual cycles, pregnancies, allergies, bowel discomforts, and so on. Whether it is with soft tissue problems or functions related to body organs, it is still best to take Chinese medical herbs to assist with general circulation and body equilibrium, since the combination of herbal intake with acupuncture can always help with bringing the body towards a better condition. Acupuncture treatments are best administered at a minimum of 3 times a week in the beginning phases of treatment. This can help you and your doctor evaluate the responses of your body to treatment and how further treatments should be designed to better suit your needs. It is also important to allow your body time and patience when receiving treatment, since your body is working on a daily basis and it would do everything possible to protect you until it cannot do that anymore, which is also when you might feel discomfort enough to see a doctor. Therefore, it will always take time for your body to rebuild itself into a more comfortable state, and therefore also important for providing it with time to rest and heal. When I practice acupuncture, I aim for treatment that is as painless or as little stimulating as possible. By this, I mean I try not to incite local nervous responses that might result in strong sensations in the acupuncture points. I would also try to avoid the excitement of certain muscles into action through stimulation. This is simply my way of practicing acupuncture because there are still many doctors of traditional Chinese medicine who prefer methods of stronger stimuli. For me, acupuncture is about the redistribution of body energies, which involves signal transfer and ionic communication at a cellular level. I also mentioned that acupuncture is, like all treatments, a procedure that requires body energy reserve, and when there is minimal pain or extra stimuli present during acupuncture treatment, the body is able to save more of its reserve energies into building itself toward a better equilibrium. This is important because injured tissue is actually made up of cells that are not able to align themselves as well as healthy tissue and cells. This loss of alignment will cause tissue structure to change and alter itself into a state that is like an entanglement of threads that cannot be untangled easily. When I perform acupuncture, I can allow these entanglements to loosen up. Therefore, the tissue and cells will be able to communicate and restore its function. This is still a gradual process that requires treatment and time, but there is always significant improvement when the body is able to stabilize itself in terms of cellular communication. In conclusion, when you are about to be treated with acupuncture, make sure you are not on an empty stomach. If you are very tired or didn't get enough sleep the night before, you might feel a little more sensitive during the treatment. It is a sign that your body is lacking reserve energies and is more sensitive to any external stimuli. Make sure that you are receiving acupuncture from a certified doctor and that the needles and medical wastes are disposed according to regulations. Last but not least, allow yourself time and treatment routines to help your body restore its vitality.